Good morning, Mr. and Mrs. America, and all the ships at sea. This is Walter Wenzel reporting Flash Viewpoint, that vaunted program in Central Illinois, hosted by the lovely, I'm reading this now from WLCN's Public Relations Department, hosted by that effervescent, lovely lady who continues her work in community service, Judy K. Busby, aided and abetted by that ailing, but not old yet. Wait a minute. Aided and abetted, that's liable. I never once abetted that girl. In any event, we're happy to be back. Oh, Judith K., on a serious note, we always tried to start Viewpoint with a kudo.
Yes, sir.
Did you know that at one time we had a couple of real SOBs in town in business? And one of them, of course, was Sweet Old Bob Grau.
Oh, bless his heart.
And Bob was so sick, and I think he asked God for permission to join him so he could be my spokesman and intermediary. And the Lord knows I'll need all the help I can get. But anyway,
he's the dearest
Bob
man.
left his children some of his great traits, part of which, among many, were community service. And I saw the other day where Chris Grau and his associates at Grau Chevrolet Cadillac refurbished some bikes from the Lincoln Police Department. Police departments all over the country acquire bikes for many reasons, and there they sat. And the associates with Chris Grau out there took some of these bikes and fixed them up and got them rolling, and they're just like new. So some youngster, or youngsters, plural, are going to have the advantage of having new bikes.
How
what
wonderful.
A neat thing for the Grau folks to do out there. So,
and what great timing.
To you, my Chris. So, all right. Listen, it's been so long since we've done this, we forgot the format. I think you're supposed to introduce the guest.
I'd like that.
Well, that'd be nice.
That would.
You have to speak up. My hearing aid is gone.
Life's tough past 80, you know.
Part of the vagaries of age.
Oofta. Yes, these people are here in a very timely manner. They are from the Logan County Health Department. Don Cavi is the head operator there. And with him is Kara Davis, the director of nursing. Now, I wouldn't believe anybody who tried to tell me they have no questions about the first of our two tragedies that have been bestowed upon us this summer, that being the coronavirus. The only thing I have in my memory that would relate in any way to that was the polio epidemics that would come to Minneapolis, of course, every summer, and you had to stay home, you know, you didn't go to things and so forth. But this is a dandy. Have you had tons of questions, people?
We have. You know, a lot of people are concerned. They want to know, what they need to do to stay safe. A lot of business operators have been calling us, wanting to know when they start up their businesses, how can they do it in a safe manner? And we welcome the questions because it just shows that people are concerned and
Yes.
they want to do the right thing.
Who calls the shots on that? Don,
Well,
who says you can open Tuesday?
The Illinois Department of Public Health, in the governor's office, they're working together and they're creating all the guidelines throughout the state that people need to follow. For instance, we had the shelter-in-place order.
Yes.
And we right now we're in phase 3 of Restore Illinois, which gradually we're moving in a positive direction. Hopefully we'll get to phase 4 at some point, but they're setting the guidelines, and as the local health department, as certified through the state of Illinois, we do have to support any recommendations that the Illinois Department of Public Health or the governor's office is making. And granted, people are working with that, and we're working with the people. They understand what the guidelines are, and we're trying to assist in how they can work with those guidelines.
We've gotten warnings from every level, as you say, about this is nothing to mess around with, Still, people were just absolutely irate that they couldn't go to the local pub or the local restaurant or the local what have you. Did you have a lot of questions in that regard? Because
Oh, yeah.
I think it's kind of silly to fly in the face of all the experts who are supposed to know what they're talking about. They're probably getting paid $2.98. They should be listened to.
Yeah, I thank the good Lord. I've got empathy, and I think a lot of us do, and I understand because it's frustrating for me. I love to go out and with my family have dinner just as much as everybody else, but I do understand too that the importance of why we have to do this, and I think people were frustrated, and I understand that. We all understand that, but. I can't say how proud I am in the community that, overall they've done a tremendous job at social distancing, at preventing gatherings. And we've even had churches call us and say, we want to have services, but what are we supposed to do? And they actually listen to us, and we appreciate that. And I think people are using common sense. But to answer your question, there is a lot of frustration out there, and we understand that. But we just have to be patient and hope that at some point we can get life back to near as normal as possible.
Can you kind of give us a list of what we can do now that's socially acceptable that wasn't last week?
Well, and you're looking at the Restore Illinois plan, Phase 3, and I'll refer to that. We can, gatherings of 10 people or less are now acceptable. However, the state, and we support this too, is still recommending wear a mask when you go out in public, to public places, to help prevent the spread. We also encourage people to maintain a social distance of 6 feet or more. So we're still gonna promote that. And as long as people could use common sense to stay within those boundaries, there's other things people can do. Wash your hands, and and we're not gonna police all that, but we're just gonna tell people this is what the state's saying you have to do, and use your common sense.
But Mr. Cavi, therein lies the problem. You use this term common sense, and so much of that is lacking. Some people don't have the common sense to use it, and other people don't have the common sense to follow the word common sense. And my brother and I are very close. We talk almost daily on the telephone, and he's out in Colorado, and he's now in Arizona. Anyway, it doesn't make a difference. The public doesn't care about that.
Well, but it's nice to be friendly and open with them.
In any event, we've kind of agreed between us that we're going to have to follow these things. This is a very serious problem for the country, for the world, really. And I don't think we understand that until we have somebody in our family that got sick with the virus. And I think we, the public, need to understand that this is indeed what they say. It's a very, very serious matter, and we need to follow the rules.
Yeah, and you're exactly right. While most people have common sense, there are people out there that don't. But, I think the people that have common sense can recognize the people that don't have common sense. And, so if someone who doesn't have common sense is not going to practice social distancing, hopefully the people with common sense will understand that and try to still maintain their distance from those people. So, you can only do so much as a health department and as a community. And I know that's part of the frustrating part of life. We wish we could change everybody, and you just can't do it, but we can certainly do our best to try. So
we like to do kudos up here, and I want to throw a quick kudo in for the folks at the Christian Village. They're doing a very good job out there of communicating with us, those of us who are residents, making sure we understand what's going on. They furnish masks for each and every one of us, even though those of us who live in the duplex apartments, not just the nursing home proper. They're doing a good job of communicating, which I think is very, very important, particularly in these uncertain times.
Absolutely. Yep. And that's the key, is communicating and getting the word out there, and just education, learning, understanding, and using that knowledge and applying common sense to it.
One of my greatest fears during this whole business has been that it would take hold at the prisons, because you have confined populations, and I should think it would go like wildfire. I know there are nursing homes who have a confined population who've had an awful time.
Yeah, we've, knock on wood, we've only had, go ahead, Kara.
Logan County has done very well with maintaining the social distancing in the nursing homes and maintaining the restricted visiting. And with the prisons, they are doing a fabulous job in keeping the spread down, at least here in Logan County. I try not to follow the other counties just because I know I need to concentrate on what's happening in Logan, but they are doing a very good job in maintaining the social distancing and keeping the virus down. But yes, there are some nursing homes throughout the state who are having some trouble.
Oh, a terrible time.
Yes.
Early on, I heard of one case at one of the prisons, but I never heard of any more.
They had two. Yes, they had an employee from Logan County, and they had a inmate from Logan County. Yes.
I think that's just miraculous in that population.
Yes, they've done very well.
What about this off-spin of it that strikes children?
Yes, they haven't spoken much about that in the last few weeks. But yes, that's pretty scary, actually.
Well, in essence, is it a form of pneumonia or a spin-off thereof, or not related at all?
I related more to the flu, actually.
I think it's a combination of both, actually, the flu and pneumonia. I know a lot of people in December and January were very sick, and they were diagnosing them with pneumonia, but the antibiotics weren't working, which is normally what works for pneumonia. The flu tests were all negative, so they think that that group of people may have had COVID-19. So I think it's a combination of both the flu and pneumonia, which would be horrible.
Yeah, and the one thing that distinguishes the COVID-19 from the basic flu is the shortness of breath. Am I correct on that, Karen?
Well, not necessarily, because sometimes with the flu you can have the shortness of breath. I think it's just the combination of all the horrible symptoms that you can have with it.
Yeah, but that is one of the distinguishing factors that they say with COVID-19 is if you are, shortness of breath is one of the things to really look out for too.
How did it happen? Where did it come from?
We are all hearing the same story, It came out.
We blame the Chinese.
The animals? Oh, the Chinese.
Yeah.
I heard that it was animals.
Well, the man that ate a bat in China.
You can hear whatever you want to listen to.
Poor choice on the menu.
Yeah.
The bottom line is, whatever you want to listen to and believe, go ahead.
They went from that, and then also the live animal markets, and now you hear about the laboratory, and who knows. The only thing is we know it's here, and we just have to do our best to...
Well, it's a big thing, but how has it impacted your workload at Logan County Health Department?
Early on, it was a mad rush, to be honest with you.
Trying to scramble around, find out what's right?
Yeah, we knew about it in February. The concern level statewide, including Logan County, started to go up, and then once we hit March, we realized, this is reality. And I really have to give a shout out to our Emergency Operations Center here in Logan County. They just are tremendous. The sheriff and the EMA, Emergency Management Agency, they were quick to pull the EOC, Emergency Operations Center, together here in Logan County. They brought us in early. We sat down. We met with the county officials, the state's attorney, the county board chairman, Emily Davenport. We also, brought in the hospital. We brought in 911, fire, and a whole group. And eventually the prisons got in on this. And we've been meeting routinely, working as a unified group to respond to the COVID-19. So every press release that we did in conjunction with the hospital went through our EOC. We want to make sure we had the right message out to everybody. But I really have to give kudos to the community as a whole, but also our EOC for really mobilizing and getting us going with this. I also have to give a shout out to our staff. Our staff was wonderful. They just jumped right in, and we had a lot of people doing jobs that were outside of their normal realm, and really have made some adjustments. It really is a group effort on that. So
it can truthfully be said then there's a TV expression on it advertising is on it. The folks that are involved in this, by the way, such as in your department and all the rest of them, you're on it insofar as you can be each and every day. You're meeting with people and you're exchanging ideas and you're exchanging information. So we can rest assured, Joe and Susie Smith, as they're walking around the courthouse square, that we're in good hands here.
We'd like to think so.
Yeah, we like to and again, in terms of the responders, and I say the health department, but I also include all those other entities on our EOC.
Right.
We're all responders. We have our responsibility, but then again, it's really a lot of it's up to the people too. And the one thing we've been really pushing in terms of this response, and you know, we consider ourselves responders, and you know, police, fire, and the hospital, the whole 9 yards. But really, in this particular pandemic, the community has been the primary responder, and we've really relied on the community to be a responder. And that means wearing your masks, you know, maintaining social distancing, preventing gatherings. And I can't say enough for the community and what a great job they're doing. Now, have things kind of laxed up a little bit? Absolutely. You know, we're in phase 3 now, and people are thinking, well, you know, we can do more. Somebody had told me last week they were out at the grocery store and half the people were wearing their masks, and you know, that did prompt us to.
I think not all be wearing them.
Yeah, that did
We're
prompt
not
us
over
to.
this
Absolutely, we sent out a press release and reminding people, said, hey, you know, we only have 11 cases in Logan County. There's a reason for it. It's because people were very responsible, and we have to maintain that. We can't just give up at this point. We got to keep wearing our masks. We've got to, you know, and continue practicing. And with all the, you know, positive public health practices.
For instance, I drive up to a drive-up window for some food. I wear the mask at the drive-up window. And I'm happy to see usually the folks that are serving me are doing the same thing. Now, we didn't opt to wear a mask in here in this little studio because Judith's perfect and I don't have to worry about her.
Right. You nailed that one, Bill.
Jim, Mr. Rice asked me if I wanted to sit next to her in the doorway.
He thought I was germy. Now, the weather having changed, I should think would have an impact on this staying at home and avoiding the crowds, because that's easy in March.
Right.
You know, but it's June now. And then we hear the forever doomsday sayers saying, well, wait till fall though. It's going to come back with a horror. And then the next guy said, no, not till winter. It'll be back in the winter. So, with your eye on the ball, guys.
Well, go ahead, Kara.
We have no idea. And that is because nobody has ever had this before. So we don't know. We just have to day by day. And that is what we do. Things with this virus have changed day by day. I don't even know what to say just because everything is so up in the air. We just don't know yet. Hopefully by fall we'll know.
Well, you know, Kara said she had no idea, and I have an idea that if we don't take a break for a commercial, we'd be in deep doo-doo up here. So go right ahead,
Off the air again.
Right, back live in the studios here, the program of Viewpoint, of course, where Judy and I are happy to be back live talking with you. By the way, Judith K., one of our commercials was for Lincoln College. That's a kudo I want to make right now. May I stop right in the middle of everything and give a kudo to Lincoln College?
I'll just talk among myself, yeah.
Okay, you go right ahead. You and Karen Don. No, seriously, President Dave Gerlach and his administration have had their hands really full with this virus business. Educators at the college level, you know, they're jugglers now. From day to day, they hardly know what to expect in the fall. The president and his staff have just done a tremendous job, particularly with reference to this racial thing that's going on in the country today. The president issued a statement. It was a statesman-like piece of work, and so I'd like to give a little kudo to President Dave Gerlach and his administrative staff. Now,
I'm glad you did that. It's nice.
648, by the way, 648-5510. Our guest this morning, Kara Davis and Mr. Don Cavi, folks on the front line with this virus problem we're having the world over. Logan County Health Department, vital to us long before the corona came along, or even Budweiser for that matter. No, seriously, I have a great deal of respect for the folks out there on 3rd Street. They do a yeoman's job for this folks in this area, not just with this virus thing, but Kara, maybe you could just kind of touch on some of the services that you form out there. They're excellent.
Yes, thanks. Actually, we are back open. We closed for a little while with services because of the quarantine, social isolation, but we are back open now. We're open 7:30 to 4:30, Monday through Friday. We are seeing people for appointments, by appointments only, for vaccinations. We do babies all the way up to 100 plus, so any vaccinations that you need. I looked at both of you, not just you. I was actually going to say 96. We also do lead and hemoglobin testing on the littles that need those for school. We do STD testing, which is completely free to the person. Vaccinations are our big thing, especially right now, trying to get everybody vaccinated for back to school. We don't want to have an outbreak of something else that people aren't being vaccinated for in addition to the COVID-19. So we're really encouraging people to call and come in for their vaccinations. We take all insurances, Medicaid, Medicare now. We have the new shingles vaccine. That has to be ordered for the person. Hepatitis A vaccine is a big one that we're really trying to push with people. It is not a requirement for kids to go to school. It starts at age 1, and it is a set of 2, 1, and then 6 months later another. It's also for adults as well. That's a very important one that we had started to push before all of this. What else do we do?
Well, our environmental health services are continuing on. You know, people have to, and we're still out there pounding the pavement, doing our inspections. You know, we're assisting food establishments because they have a lot of questions. Wells and septics are still going in. We're still, going out and doing those types of things.
WIC, the Women, Infant, and Children, we are still doing WIC. Dana and her staff have been amazing with maintaining the social distancing and seeing the clients in the parking lot. It has been great. They've been great.
It's worked well then.
It has worked well.
I bet when going into it you thought, oh.
Yes, it was a little tedious at first. I'm hoping that come July we'll be able to start allowing the women, infant, and children back in for their appointments. I think it would just be easier for the staff and for them. So.
Our only direct experience with the health department is we get our flu shots when we're supposed to get them. And I want to tell you, that's a flawless, seamless operation. You're in there and you're out of there in no time at all. And they're very, very nice people, very polite, very professional, and it doesn't hurt either, by the way. No, seriously, and I really urge people to get their shots whenever they're due. But that's well done out there. You've got that organized down to a science.
Well, thank you. We try really hard.
Yeah, I was going to say too, and we are, SIU is still operating in our doors too, and they're still seeing patients, but everything, it's all by appointment right now. So this whole pandemic has changed a lot of things. It was nice when we could accept walk-ins, but now we're asking people to call and schedule appointments.
Is that in the longer view, do you think? Do you think things are going to be changed monumentally enough so that it'll go on, or will we go back to accepted practices?
We have to kind of, every month we have to take a look, see where we're at, see where this is going before we can make a determination on that. We'd like to see it get back to the way it was, but then again, we just don't know. We're just going to have to make assessments as we continue onward.
Are you a testing station for the coronavirus?
No, we are not. Logan County does not have any testing stations. The hospital does have the capabilities, but you have to actually be in the emergency department or be going there for a test. Or not a test, I'm sorry, going there for a procedure. So anyone that has any sort of surgery or outpatient procedure or anything scheduled has to have a COVID test 3 days before the procedure. And the hospital will do that if the test is scheduled at their hospital. And then if you have symptoms and you're in the emergency department and they think that maybe you have COVID, they will test you there. Nowhere else in Logan County is doing that. We have been sending people to Springfield. St. John's and Memorial both have drive-through testing centers, and that's where we are sending people.
And they will allow us foreigners in there?
You have to call. You have to call first, and they get your information, and then they call you back and tell you when you can come.
Okay.
Yes.
You know, I'm sitting here doing a little reminiscing, and I'm thinking Irma Potter was a Logan County nurse, health nurse. She was a forerunner of the Logan County Health Department, in fact, and she did all these things as a single person. She was a wonderful lady. She was a county nurse.
I remember that.
You remember Irma? And I was chairman of the Elks Crippled Children Commission way back, and we'd see a patient, and she'd say, well, patient needs so-and-so, and Irma would call me up and ask for permission to buy something, and I'd say to her, Mrs. Potter, if you think they need it, they need it. You just go right ahead and do it. But she was a forerunner of our Logan County Health Department.
Yep.
Did a magnificent job. Wonderful lady.
Well,
dedicated,
speaking
really
of
dedicated.
nurses, I have 3 public health nurses, and one has been there for a very long time, Mary Anderson, and she is just
Yes.
amazing.
Oh, she is a top
has
drawer
just
lady.
taken the reins on this COVID, and she is so organized, and she's doing a great job. And my other 2, Carrie and Cindy, they're doing great too. Carrie has been helping Mary with all the contact tracing and going out to our positive COVID patients' houses and, telling them about their isolation, and they've been great, all of them.
And I can back that up too, by
Yeah.
the way.
John, you've been with us how many years now?
I've been with the health department for 10 years, since 11 years,
Hard
coming
to
on
believe.
11 years. And
Hard to believe.
It has been. And speaking of years, our health department is going on 50 years, coming up here real soon.
The health department?
50-year celebration, yeah.
Really?
So, yep. So we're excited about that. So
I was
hopefully
on
we
the
can celebrate
board
that.
early on, probably about close to 50 years ago. Good grief.
Yeah, it's amazing. So that's a huge milestone. So
Is there one health problem that worries your offices a little bit in the county? Is there one issue of health that would be of more concern to you than any others?
Right now, it's COVID.
Yeah.
Right now, that is all
Yeah,
we deal with.
yeah,
And
yeah.
if it's not COVID, it's the flu.
Yes.
Those are the 2 things that we are really big.
Well, now the president got this medicine that they talked about. And of course, he caught tons of, I'm trying to clean this up, flack. Thank you.
Careful, you're in the air.
Thank you, Jim. Tons of flack for that. But how are they coming on a means of treatment?
I don't know. I think they're trying different things, and just fingers crossed that something starts to work. But right now, what we have heard, nothing's really working. They're just treating the symptoms.
Well, it just comes at you out of the blue. You can't expect the cure to come the same way, can you?
No, that's correct.
yeah, I mean, that's why we're really pushing prevention. That's really our only defense at this point.
Yep.
Does your information that you get regarding the virus that come strictly from the state, or do you get national input as well?
Well, we get our information from
Or
the
is it
state.
filtered down?
We get it from the state, but they get theirs nationally through the CDC.
Yes. Yep.
Yeah, and that's a great resource. We really rely heavily on what the state of Illinois / CDC provides, because that's the type of information we share with the community.
On balance, how has Logan County done as opposed to the other 101 counties that there are?
I feel like we've done an amazing job. I mean,
Yeah.
11 positives, and 10 of
Yes.
those are recovered. Now, the 11th is a repeat, so I wouldn't say technically she's a new positive, but She was one of our first positives, actually was very symptomatic at the beginning, was tested, was positive, recovered, and then now is positive again, and she has no symptoms whatsoever. She was tested because of the facility she is employed at, tested all employees.
Oh.
That's why she was
is good.
retested. So she is isolated at home, and she's doing well. So after 2 weeks, she'll be...
But bottom line, it's up to each and every one of us to do what we can, do our part, so to speak.
Absolutely.
Which brings us to masks. You both arrived this morning wearing masks. Mine was in the car. We opted not to wear them in here because of for whatever reason we opted. But, and I mentioned wearing a mask when I go to a drive-up window. Is that a recommended thing to do?
Well, I think the mask is more to, if you wear a mask, it's so you're protecting other people.
Right.
So it's probably, either way, the best thing optimally is for both people to wear a mask, obviously.
It's not going to hurt
Err
anything.
on the plus side.
Yeah.
You know what? It's not going to hurt anything if you wear a mask at a drive-through window.
No,
What's it going to
no.
hurt? Absolutely nothing.
It's better overkill than underkill.
Exactly. And now riding alone in your vehicle, no, you really don't need to have a mask on when you ride alone in your vehicle.
Yeah.
You really, when you remove your mask, you should put it in a baggie. You should not keep it. You really shouldn't keep it up
A
because
point well made now. Here, now you stressed a point that I don't think any of you
I know.
do.
I'm not very good about that either, but that's my fault too.
In
I
other
need
words,
to
you're
be more-
suggesting take a little plastic, little polyfilm baggie, and put the mask in there when you're not wearing it.
Correct. Yes.
Well, won't that just capture those little boogers and keep them in there?
It's either that or they're in your car or in your purse or on your whatever surface you're
Mine
riding it on.
are in my purse.
The one thing
They
I-
are. Didn't even think about
I
it.
know, mine are too.
Yeah, and the one thing I see people do, like when you're at stores, is people wear gloves. And to me, a glove is like a hand. You can get a glove contaminated just like you would a hand. So really, it's the most important thing is a hand wash. If you're going to wear a glove, you have to wash your hand before you put that glove on, because if you don't, you're touching that glove with soiled, germy hands, and you're just contaminating the glove. So what's the point of wearing the glove? So people see that, and it creates a false sense of security that I'm just because I'm wearing a glove, it's going to protect. But they need to make sure they're doing it properly. I'm not saying there's anything wrong with wearing a glove, but people just have to remember a glove's no different than a hand.
Well, and further on that, I've got a cloth mask. I noticed you did too.
I do too.
And they say you ought to be washing that
I do,
right
yes.
along. Well, I did wash mine a couple of days ago, but I sure don't do it every day.
No, I don't recommend washing it every day, but every couple of days, and obviously when visibly soiled as well. So.
Well, the home out there, they passed out masks, as I alluded to earlier this morning, to each and every one of us, even those of us who live in the duplex apartments. I don't wear mine on the street because I don't want people to say he's from the home.
Oh, piffle.
We try to make light of this as much as we can because it's a serious and heavy matter for the world, not just this country. But each and every one of it's up to each and every one of us to do what we should do and what we really know best to do, because the Public Relations Department nationwide has done a pretty good job, I think, of disseminating information on what to do to protect yourself and your neighbors and your friends.
Yeah, we're again, and people are doing a great part of this, and people ask me, how do you define public health? And I tell this to everybody. Certainly the health department is at the center of it all, and that's our job, is to work with the community. But public health is really a broad definition. It's police, it's hospitals, medical community, fire department, nursing homes, schools. We all have to do our part, and it's also, in this case, the community. So it's very broad, and people just have to, and they're doing a great job. They just need to keep up persevering and continue to practice the safe practices. We certainly want people to get out, and we're a health department. We want people to get exercise, get out, enjoy the weather, get some sunlight, eat right, and continue to be healthy, because part of avoiding this virus is maintaining a good immune system. And you want to make sure that you're eating right and you're getting the exercise. So
Are your
I think it's
clients that
important
walk
to do
through
that.
your doors out there on 3rd Street, are they pretty cooperative? Seem to
yes.
be aware of...
Yes. When they call to make the appointment, we ask them if they've had any symptoms. We ask them if they've been exposed to anybody who is a known positive. And then when they come, we ask the same questions to take their temperature, and they have to wear a mask.
Now, I heard, of course, all 5 of us have all heard everything you can think of, right?
Yeah.
Well, one of the things I heard was that if this virus is exposed to the sunlight, it can't live.
I've not heard that.
I haven't heard that either.
Well, there's a new one for you.
Yeah.
That would be great, though, but I have not heard that.
No. So it's, like Kara said earlier, there's just a lot we still need to learn about this. It's just...
The CDC is amazing, and they are doing so much to try to learn whatever they can about this virus.
How did it morph into this children's disease? Because they were exempt for a while.
Yeah, we started seeing cases of young early on, though. I would say back in March.
Oh, did you?
Because the range is now less than 1 and through 100, or up to 100. But I think we saw a 3-year-old at the very beginning of this, and that's when we started telling people that this virus is not selective. It can attack anybody. And again, like we said earlier, you're better to play overly cautious, and everybody should take precautions. No matter what age you are. But it is true that, the immunocompromised and certain age groups are going to be more susceptible to this, but it doesn't mean that everybody is, immune from it.
You're supposed to be wearing a mask if you're 2 or over. I say thank you God I don't have a 2-year-old.
I
I'm
have a
sure
3-year-old,
that would be
so.
going to the wall every time you talked about it.
Yeah.
What do you tell people who have a 2-year-old?
Well, just do your best.
Do your best.
I have a 3-year-old, so
Same difference.
Yeah, same difference. Actually, she is an exceptional 3-year-old. She thinks she's 12. She acts like she's 12.
Well, she's got a mother that knows what she's doing.
Well, she also has an older sister, so that's helpful. But she is actually very good. I just explained to her that, you get to wear one like Mommy and Sissy, and she's great about that. So she's been really good about it. So, you just have to make it fun.
Yeah.
Oh, good.
But also, I have kept my kids very isolated. So they have been around certain friends, but other than that, they've been isolated. They haven't been to a store in months or a restaurant. So,
Mr. Cavi, as the administrator of Logan County Health Department, do you feel like a juggler sometimes? A lot of balls in the air. There's so many different ways that call for you to make a decision, this or that. Being an administrator today has got to be a tough job, and I mean that very seriously.
Yeah, it's never easy, despite COVID-19, we still have other things that go on at the health department, and I know
that's called life.
Yeah, there's still, we can't forget about the flu, and we can't forget about our children that need WIC services and whatnot. But I will say this, and what makes my job easier is having a terrific staff, having people like Kara and her staff and our entire crew at the health department, great resources. I certainly do a lot, but I don't know everything, and I have directors that do know their departments very well, and I can refer to them if I need resources. And so it's really a team effort, and it really makes it much easier. But it's not to say there's challenges. There's a lot of challenges.
Have you told us yet what you're going to do about the rioters?
We're going to hope it never happens in
no
Logan
comment.
County.
I want to tell you quickly.
Could they be medicated?
Off
boy.
air, we exchanged this story, and I saw this picture on my computer, and it was a very satisfying. It was a karma moment. This idiot was shaking his light pole, and apparently was obviously loose at the base, and he was bound determined to bring it down. And he was shaking it violently, and the light lamp fell off on his head. And I thought that was the most satisfying pictures I've
I
ever
saw that
seen.
as well. It was pretty funny.
That's what they mean when they say the light has dawned.
Exactly. I want to echo what you said earlier, Mr. Cavi, about your staff. Without fail, of course, we don't get into the pregnancy part of your staff because I don't know anything about that. But no, seriously, the folks that we meet out there are all very professional. It's a seamless operation from a client standpoint. And I know it's not seamless from an administrative standpoint because you've got a lot of things to take care of. But I just would pass on to the public that you should not ever hesitate to go to the Logan County Health Department if you think you have a problem.
Absolutely, thank you. And
I appreciate that.
and the COVID-19 hasn't been convenient for any of us. And we right now, as we said, we're for safety purposes for the community hours, we've been keeping our doors locked and we've been seeing people by appointment. We know it's not convenient, but we appreciate the public's understanding that not only us. I talked to several health department administrators. They're all keeping their doors locked right now, and it's just a safety procedure. And again, we're not trying to be inconvenient to people. We're just trying to do what's right. But our phone number is always available. All people have to do is call and schedule an appointment, and we'll get it right in.
52317.
735-2317.
See, I still remember that
Go
number.
at the head of the
Yes.
class.
Can't remember what I had for breakfast, but I remember that phone number.
Which reminds me, we've got about a minute and a half left. 648-5510 if anybody wants to conclude this program. Ask Mr. Cavi or Mrs. Davis a question. My goodness gracious, I'm so bad about that. We get involved in what's going on, and I forget to remind the customer.
Well, you're gooder than I am at it, so
So, Don Cavi and Karen Davis, we really appreciate your being with us. You take some time out of a real busy schedule. Thank you very much for showing up with us this morning.
Yeah,
If
thanks.
you
Thanks
have
for
a
having
final
us.
statement, go right ahead.
Well, we just want to encourage the community to be vigilant, continue to practice safe practices, wear your masks, social distancing, be patient. If the public has questions, if business have questions, they're always welcome to contact the health department. We're more than happy to provide guidance. That's what we're here for. But again, we just ask people to stay strong, but still try to enjoy life, get out, get some exercise, and but just use your common sense. And we want to thank the community for being playing their part as a responder as well.
good recipe for living all around.
And wash your hands.
Yes.
Yes, there you go.
Yeah, there's something we don't do very often at all.
I don't know. I think people have really increased the hand washing recently.
You're going through soap at the health
Yeah, the
department.
soap aisle's been empty in the
Started
grocery
off Viewpoint
stores.
this morning with what I always like to say, be the reason somebody smiles today. Thank you for Viewpoint.
Yep.
But